Hello, my name is Christy Walt, and I'm here today to discuss the Affordable Care Act and its impact on Washington State. Prior to the Affordable Care Act being signed into law in 2010, healthcare was an industry fraught with complicated definitions and coverage loopholes. Healthcare in the United States was a business to make money, and the pitfalls of being an American citizen looking for medical assistance were daunting. If an American could afford insurance, there were few individuals who had the knowledge to explain the common terms that permeate the healthcare industry, let alone walk a patient through the billing nightmare that can exist with a continuous and expensive cancer treatment. One of the benefits established by the Affordable Care Act is the elimination of lifetime limits as they apply to essential health benefits. Susan Jaffe wrote an article published in the AARP Bulletin in August of 2010 stating that more than 100 million Americans have insurance that stops when medical claims exceed their policy's lifetime limit. 10% of cancer patients surveyed for the article said they hit their lifetime limits and their insurers would not pay for continued care. There is example after example of situations where an individual reaches the maximum lifetime cap and has to choose between death and debilitating debt. Parents are mortgaging their homes and appealing to the public for donations to save their children, as the cost of a potentially life-saving bone marrow transplant exceeds $500,000, and their health insurance coverage is essentially non-existent. The Affordable Care Act has also eliminated pre-existing conditions. A pre-existing condition is defined by the medical dictionary for the health professional and nursing as a health problem that existed or for which treatment was received before the effective date of a new insurance policy. Simply stated, if a woman goes to see her family doctor and does not have insurance, and at her appointment she discovers that she is pregnant, the entire pregnancy, including all prenatal care, any complications, and the birth of the baby, will not be covered as the condition was diagnosed prior to establishing health care coverage. Research suggests that the Affordable Care Act and Washington State Apple Health provide a benefit to the citizens of the state of Washington through the creation of the Affordable Care Options accessed via the Washington State Health Benefit Exchange. Healthcare reform is nothing new. In fact, healthcare reform is a road that Americans have been walking since President Roosevelt was in office. In an article written by Taylor, J.D., Stites, and Harbison entitled A Brief History on the Road to Healthcare Reform from Truman to Obama, we see the impact that each administration has had on healthcare reform. Truman was the first to recommend universal health insurance coverage to Congress. In 1956, Eisenhower enacted military Medicare into law, which granted Medicare coverage to military dependents. Kennedy supported the King-Anderson bill, which advanced health care coverage attached to Social Security to those 65 years of age and older. Johnson established Medicare and Medicaid in 1965. Nixon proposed minimum levels of insurance coverage. Ford made advances toward reining in the escalating costs of health care, and Carter campaigned for national health insurance. Reagan passed the first major expansion of Medicare, and George H.W. Bush focused on eliminating fraud and abuse from the existing healthcare system. Clinton proposed his own plan to provide affordable health care for all, and George W. Bush passed the largest expansion in Medicare history. Obama signed the Affordable Care Act into law on March 23, 2010. The Affordable Care Act established a mandate requiring all citizens to have health insurance coverage. There was quite a discussion about the document that established the Affordable Care Act. Michael Bomardio states that the document signed into law was a full 1,990 pages. Just to give you some perspective, this box of Boise copy paper is 2,500 pages and weighs 20 pounds. It gives you an idea of how long the document was that established the Affordable Care Act. Now that we have the Affordable Care Act, how do Americans get coverage? In Washington State, individuals access coverage through Washington Health Plan Finder, wahealthplanfinder.org. Health Plan Finder has an application process that asks pertinent questions and interfaces with the IRS, Social Security, and the Federal Hub, returning an instant result letting individuals know what assistance they may qualify for. Choosing any of the coverage options will satisfy the individual mandate for individuals to establish health care coverage. But what if an individual doesn't comply with the mandate? Let's refer to ObamacareFacts.com. If an individual does not obtain coverage and is not exempt from the mandate, it's the government, folks. There are exceptions to every rule. There will be a penalty assessed by the IRS. The penalty does increase annually until 2016 when it levels off. The Affordable Care Act benefits the residents of Washington State through Medicaid expansion, which created Apple Health. Apple Health provides benefits for all residents who earn income that is less than 130% of the federal poverty guidelines. Apple Health offers the same benefits as traditional Medicaid to an extended group on individuals based on income guidelines. What if an individual earns more than the allowed amount for Apple Health coverage? The Affordable Care Act benefits Washington State through the creation of affordable health care options accessed via the Washington State Health Benefit Exchange. Going back to the Obamacare Facts website, we find that individuals will qualify for health insurance premium tax credits, which can be used to reduce the monthly premium payment amount. There are also cost-sharing benefits, which can further reduce an individual's out-of-pocket medical expense. Cost sharing is a limitation of the total dollar amount an individual is expected to pay based on annual income amounts. If an individual earns less than 250% of the federal poverty income guideline, they will qualify for the cost-sharing benefit as well as tax incentive credits. Once the Washington Health Plan Finder has determined if you will qualify for health insurance premium tax credits, what's next? Each applicant can review the qualified health plans available in their area and choose a plan to establish coverage. There are multiple plans offered. Plans can be sorted and reviewed by cost, by coverage option, by doctor, by medical facility, by distance, and by metal level. Metal levels are the tiers established by Washington Health Plan Finder and the federal government to differentiate between the different plan levels. The more expensive the associated metal, the more expensive the premium, but you get what you pay for. The higher the premium, the less an individual will pay out of pocket. A gold plan will cost more for premiums, but will pay a higher percentage of your medical bill. In conclusion, we can clearly see the benefits of the Affordable Care Act and Washington State Apple Health. They provide a benefit to the citizens of the state of Washington due to the establishment of affordable health care options and the enhanced access to health care. The Affordable Care Act benefits Washington State through Medicaid expansion, which created Apple Health. I think President Barack Obama said it very well when he addressed the attendees of the American Medical Association at their annual conference in 2009. He said, "So to say it as plainly as I can, healthcare is the single most important thing we can do for America's long-term fiscal health. That is a fact. That's a fact." Thank you for your time.